Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 1. Shock. Primary assessment. 1. Rapid recognition and prompt intervention are essential to increase the chance of survival, because a downward spiral of physiologic responses will occur if shock is not treated. 2. The initial priorities in the assessment are the same for all types of shock are as follows. Is the airway open? Is the patient breathing? And is there a circulation problem? 3. Initiate immediate interventions as indicated. Resuscitate as necessary. Administer oxygen. Start cardiac monitoring. Control hemorrhage. And 4. Pain management is essential. Subsequent assessment. 1. Assess level of consciousness. It is important indicator of shock because it reflects cerebral perfusion. Changes may include confusion, irritability, anxiety, agitation, and inability to concentrate. 2. Watch for increasing lethargy progressing to obtundation and coma, indicating progression of shock. 3. Monitor arterial BP. If the patient can compensate for the shock state, the BP may initially rise approximately 20%. A significant decrease in BP may not occur until late. Narrowing pulse pressure is early in shock. The diastolic pressure may rise due to an initial vasoconstriction produced by release of catecholamines from the sympathetic nervous system. Fall in the systolic pressure. There is no absolute value in BP that indicates a shock state. It is the deviation from normal that is important. However, it is generally accepted that a systolic pressure below 80 mm mercury or a mean arterial pressure below 60 mm mercury is indicative of shock. 4. Assess pulse quality and rate change. The rate usually is increased, weak, thready pulse due to decreased cardiac output and increased peripheral vascular resistance. 5. Assess urine output. A decrease in renal blood flow or pressure will result in decreased urine output. Ideally in an adult, the urine output should be 50 ml per hour. An output of less than 25 ml per hour may indicate shock. 6. Assess capillary perfusion. Pale, as hen, mottled, cold, and sweaty skin indicates potent vasoconstriction. Capillary refill greater than 2 seconds indicates vasoconstriction. And 7. Also assess for subjective feeling of impending doom. Metabolic acidosis due to anaerobic metabolism within the cells. And excessive thirst. The following figure shows the general pathophysiology of the types of shock. Figure 1. General pathophysiology of cardiogenic shock. Figure 2. General pathophysiology of hypovolemic shock. Figure 3. General pathophysiology of neurogenic shock. Figure 4. General pathophysiology of obstructive shock. And Figure 5. General pathophysiology of septic shock. For instance, central nervous system. Kindly click the next button for part 4. Thank you for listening. Have a good day and be safe. Agyamanag.